Good afternoon and welcome to Healthy Living. I am Blessing AJ. Now today on Healthy Living, we'll talk about constipation. Almost everyone experiences constipation once in a while. At least you hear people say that they're constipated. You get to hear that once in a while, like I said earlier. And that's how we're looking at constipation in its entirety. By that I mean the causes, how severe it can be, and then treatment for constipation. Now, this is something that is not restricted to only adults. I personally have experienced constipation, and I want to know what causes it, how it happens, and how I can get treatment when it does happen. I have Dr. Johnny Musa Iguma here with me. You're welcome, Doctor. Yes, the last time you were here, we were talking about hepatitis.
Yes.
Now, today we're talking about constipation. So, have you experienced constipation yourself?
Yes, I have. Everyone at a time, for as much as you take food for survival. So the kind of food you take and then maybe your lifestyle, that could be the reason why you must have experienced constipation at any point in your lifetime.
Okay.
So constipation is a thing that will not be strange to any person, considering the fact that you eat food and not all the food that you eat will stay in your body. You take food through your mouth and digestion will have to take place.
Okay.
This food have to be broken down and, you know, the required one will go into the blood to supply nutrients and energy for the body function, while the undigested one will have to be digested as a fecal material through the anus. So if at any point in time during this digestion and there is a disturbance in the movement of the fecal material, maybe as a result of tumor in the intestine, or there is an ulceration, or maybe there is a kind of an adhesion, that is blockage within the intestine that will disturb the movement of the fecal material. So automatically somebody will experience constipation. By definition, we will say that constipation has to do with infrequent passage of hard stool.
Okay.
So what it means is that, just like the way I've said it, you take food through your mouth, you masticate it, as in you chew it.
Okay.
It goes to the esophagus, enter the stomach, that acts as a storage, and also from further mastication and enzymatic action.
Okay.
From there, the food goes to the small intestine, which is divided into the duodenum, the jejunum, and the ileum. So from the ileum, the food goes to the large intestine. So it is the large intestine that is responsible whether the particular food that you are eating will be constipated or not.
Okay.
Because the function of the large intestine actually is to absorb water from the food that you are eating.
Okay.
So the large intestine is divided into four. We have the ascending, we have the transverse, we have the descending, we have the sigmoid, and we have the rectum part.
Okay.
So if at any point in time that the food that you are eating is passing through these four parts of the large intestine, and there is a delay in motility, what it means is that the rate
at which
with
moving.
which it moves, that is slower.
Okay,
Because
than normal.
Exactly. So the food, of course, which is a form of a physics now, because what the large intestine does, apart from the fact that it stores food, it also helps to absorb water from it, so that your body will not lose water and electrolytes. So if the motility now, if it is slower, it therefore means that water will be absorbed more from the stool. So in that case, when you are now going to pass it out, you will experience difficulty. So the stool becomes hard. In that case, some persons might experience once in a week stooling, or like less than 3 times in a week.
Okay.
You know, I wouldn't say that it's compulsory for everyone to experience what we call bowel movement or defecation every day.
Okay, which in sense of the layman to be like you going to use the toilet
Yes.
in a day.
In a day, yes. If you go to the toilet every day, there's nothing wrong with that.
Okay, like normally, as a medical doctor, how many times do you think a person should visit the toilet?
Once in a day.
Once in a day.
Once in a day. But when you experience constipation, you might go to toilet like less than 3 times in a week.
In a week.
Or once in a week, as the case may be.
Okay.
And there are symptoms that you will feel that will make you feel and know that, oh, this is constipation.
Okay.
You feel abdominal pain, usually the lower abdominal pain, because of the fact that there's an incomplete emptying or evacuation of the fecal material. Okay. And you also feel bloating, you know, your abdomen becomes distended, you feel heavy, you feel, you know, very uncomfortable, like that. Some persons even they might even experience nausea and loss of appetite when it becomes like a chronic constipation, when they're unable to, you know, evacuate or evacuate, you know, the fecal material in form of, you know, or digested food material that they've eaten.
Okay, but there's a person who would tell you that it's just normal for them not to visit the loo in a day. Maybe for them it's once a week or even twice a week, and it's normal. That's how they've been. They don't feel any form of discomfort.
Yes. If we are to look at the causes of constipation, one of them is habitual inhibition of the defecation reflex. Okay. What it means is that some persons from, you know, the onset, from the childhood, they are able to suppress their, you know, defecation reflex. What I'm trying to say is that it is your body chemistry. Okay. It is a signal that will make you to know that, oh, I'm to visit the toilet. That's what we call the defecation reflex. And there's a mass action for that. There are nerves that are responsible for that, whether voluntary and involuntary. That is the brain action, as the case may be. Okay. So what it means is that when they feel that urge of going to toilet, some persons are able to suppress it. So when you do this with time, the atony, which is the, you know, defecation reflex now, becomes weakened. Okay. So because there's a regulatory mechanism there. So there's what we call the internal inner sphincter and the external inner sphincter that controls the opening of the bowel when you are about to go to the toilet. So when you feel that urge, it means that the internal inner sphincter is relaxed. So the external inner sphincter now, you are in control of it. Okay. So that is what you relax when you are comfortable of going to toilet, as the case may be. But some persons are able to, because it's at will. Okay. Some persons voluntarily just suppress it. So persons who does this over a long time, they get constipated and they feel that it is normal for them, as the case may be, because it becomes an habitual thing. Over time, they've been able to suppress it. So in that case, you see that the feces have to stay longer than expected in the large intestine, which is the last part of the digestive tract, and by so water will continue to be absorbed from it. Okay. So such persons will not even feel that, oh, there's anything wrong with them. They just feel it's a normal thing. Now, for how long should one not stay without visiting the toilet? Or without emptying the bowels? For how long should one not stay? Just like what I've said earlier, it is not actually, constipation is not actually a life-threatening situation, but it is a presentation. Okay. What I'm saying is that some persons complain of it for the reason that there are some complaints attributed to it, just like somebody that feel sensation of a complete emptying of the bowel. You know, they strain, you know, that's straining, but nothing is coming out from it. Okay. And they get bloated, the abdomen is distended. Some even feel pain, as the case may be. Okay. So when they feel these, you know, symptoms and they feel that nothing is coming out, of course it becomes a problem that they have to visit an health practitioner for a treatment, as the case may be. Okay. Are there foods that can make one be constipated? I've heard some people say that I don't eat certain food at certain time, and I can't eat
later than certain hour of the day? If I do, I get constipated. How true is
Yes,
this
you are very
explanation?
correct. If we are to consider the causes of constipation, we look at it from the gastrointestinal problem and the non-gastrointestinal problem. What it means is that it is not just a problem that is caused by disorder in the abdomen that will cause one to have constipation.
Okay.
So there are things outside the tummy,
Okay.
some problem outside the tummy that will make you get constipated.
So what are the
So
causes?
one of them is the diet.
Okay.
Some persons, they consume little or no fiber in their food. The fiber is just vegetable, fruits. And not only that, they also, take little or no water when they are eating.
Okay.
So when you consume little or no water, or when your water intake is usually lower than expected,
Okay.
so you are bound to get constipated. Not only that, there are some drugs that you will be taking that will make you to have constipation. For example, when you take opioid analgesics, a very common example is the tramadol,
Okay.
the oxycodone, morphine, just to mention but a few.
Okay.
Any opioid analgesics, those drugs, when you are taking them for one reason or the other, you might get constipated without even you knowing that this is the drug that you are taking for a particular illness or for the treatment of a particular condition is what is making you to have constipation.
Okay.
And not only that, some anticholinergic drugs, when you take those drugs,
What are those?
yes, like atropine that might be used for treating, other conditions as the case may be. Some persons that take antidepressant drugs,
Okay.
Those drugs, even aluminium containing antacid, some drugs that are used for treating ulcer that contains aluminium,
Okay.
those drugs, of course, can cause constipation. Not only that, drugs that has calcium antagonists. The example of those drugs is like antihypertensive, like nifedipine, amlodipine, and the like.
Okay.
Just to mention a few. Not only that, other than drugs, there are some neurological condition that is outside the abdomen now. Or if we are to even dwell more on problem in the abdomen, we can even go to structural problem. If we are to, talk more about problem in the abdomen, there are some structural problem. Maybe somebody that has diverticulitis. These are big names.
Yeah, so can you break it down so the person at home can understand?
It has to do with, inflammation or kind of a perforation of the large intestine. I told you that it is the problem of the large intestine that will cause one to have constipation. Exactly. So if the diverticulum, which is attached, is a structure which is attached to the large intestine, is inflamed, and the person that have problem with that diverticulum, which we call diverticulitis, such person can have this constipation. That's what I mean by diverticulitis. Not only that, colonic cancer of the colon of the large intestine can cause constipation. And we will look at it, the symptom. There's a classical symptom of somebody that constipation is as a result of the colonic cancer. Apart from the fact that the person will have this infrequent passage of stool, the person might also pass out blood. For colonic cancer, the person might also have pain, the person might also experience weight loss. So that one is, we'll say, okay, that is cancerous, as the case may be. Person that has colonic cancer, in fact, constipation is one of the symptoms. Apart from that, there are some rectal disease that might cause somebody to have constipation. For example, we know pie, that's hemorrhoid. There's somebody that has anal fissure, which has to do with injury in the anal region. Not only that, somebody that has Crohn's disease. These are conditions that doctor will have to evaluate to know actually the cause of the constipation. Other than those problems that I've just highlighted, which is restricted to the abdomen, there are conditions that are outside the abdomen, outside the digestive system now. Maybe neural causes
Okay.
You know, example is somebody that has cerebrovascular accident. Somebody that has a stroke, they suffer constipation.
Okay.
You know, other than that, somebody that has multiple sclerosis, you know, these are big, you know.
But when you say something that has to do with the neurons,
yes.
Are you talking about the brain?
Yes, the brain.
Okay, so anything that affects the brain
is capable of causing constipation. You know, I did say when I was trying to explain the physiology of digestion and defecation,
okay.
I told you that there is external inner sphincter. That is the will.
The
you know,
will
maybe you are the boss, you feel like defecating, but you're able to resist it on your own before you get home. That is the brain function.
Okay.
But when you have any brain problem, maybe as a result of
accidents,
maybe spinal cord injury, multiple sclerosis, cerebrovascular accident that I've just mentioned, even Parkinson's disease, which are very common problem of the brain. Okay. So of course, such person will experience constipation because that's, that will, which is the skeletal muscle controller, is
gone.
Is gone, exactly. Such person will have constipation. Not only that, there are also some endocrine and metabolic causes. This is no problem that is restricted to the abdomen now. Example is pregnancy.
Okay.
Pregnant women complain of constipation.
Why
two
is
reasons.
that?
Two reasons is that the changes in hormone in pregnancy could be as a result why they have constipation. And normally, as soon as they give birth, the constipation will get treated or get resolved on its own.
Okay.
Not only that, because of the distension and the enlargement of the uterus, the fetus tend to impede or the pinch, as in press on,
okay.
it tends to obstruct the lumen of the large intestine now.
Okay.
I did say that anything that is capable of causing obstruction to the movement of, fecal material, from the ascending, descending, transverse, and sigmoid colon, as I just said earlier, the fourth part of the large intestine. Anything that's capable of causing obstruction there will result to constipation.
Okay, so when there's no free flow.
When there's no free flow, and because of the enlargement of the uterus now, that impingement, that, the baby now trying to press on the intestine now, that is one of the reasons why they will get constipation during pregnancy. That is a physiological constipation, and many a times it doesn't have to be treated. As soon as the woman delivers, the constipation gets treated.
Okay.
So, other than that, there are some, even somebody that has diabetes. Somebody that has
suffered. In essence, there are some conditions that can predispose one to having
aside gastrointestinal, exactly. Somebody that has diabetes, they can, complain of constipation. They might not even know that it's their a diabetic condition that is causing constipation. Because in diabetes, there is this hormonal, insulin causing electrolytes and water imbalance, that will cause the constipation. That will be a symptom, that will not cause a symptom of constipation in them. So, seeing a patient and, evaluating this patient and knowing, this is the illness or what this
person is suffering from.
Exactly. Whenever you know this is what actually causing the constipation. Not only that, there are still other conditions like somebody that has high calcium level in the blood, like what people call their hypercalcemia. They can have constipation. Immobility, very important.
Okay, before we come to that, doctor, the number to call will scroll on the screen right now, so you can call Dr. Johnny if you have any question regarding constipation. So you can start calling right now. Yes, doctor, we're talking about immobility.
Yes. When you stay in a particular place, you don't exercise, you don't walk, and it's very common among the elderly.
Okay.
Those old men, old women that stay in one place.
Those who are retired,
they are retired,
you don't have much to do other than to sit home.
Constipation is one of their symptoms.
Okay.
Because while they are staying in one place, there is no free movement, there is loss of, tone. They experience what we call, intestinal atony.
What does that mean?
What it means is that, I told you about this motility, the movement.
Okay.
So when this motility tends to, when there's a loss in motility, so there will not be a delay in motility. So it therefore means that the food that they are eating tend to stay more because of immobility. Because even exercise itself is a treatment for the constipation. Exactly.
Okay.
So when you live a sedentary lifestyle, you stay in one place for a longer time, you can have constipation. So all these are some of the causes of constipation.
Okay, before we talk about the symptoms now, when I was a child, when we eat late, maybe between the hours of like 7:38, and you just want to go to bed immediately, you know, they would tell us then, move around. It's not good for you to just go to bed the moment you eat so that your food can digest. And I used to think, if I go to bed immediately after eating, what problem would that give me? So does this thing about exercise having to do with constipation play a role in when you eat, you need to make sure you exercise before you go to bed? Going to bed immediately after eating, does it make one come up with constipation, or can it cause it?
It's just a simple explanation. When you eat food, you expect blood to flow to the digestive tract. There's an increase in blood flow that is supposed to make these organs that are responsible for digestion to function properly. And one way you can achieve this increased blood flow is through mobility. Exercise, not, staying in one place or lying down, as the case may be. Lie down, it makes the blood to be stasis, not circulating, very well. But when you eat and you tend to move around, there's an increase in blood circulation. So enough blood goes to the digestive tract, and, because when we talk about motility, the motility needs a kind of a petrol to work, and the kind of petrol we're talking about here is the blood. And if there's little or no blood in that area, you can see that there will be no digestion. And when there's no digestion, the food stays longer than expected in the large intestine, and that might be because of the constipation. So in overall, the immobility I talked about is also what you were experiencing during your childhood.
That's what they were trying to explain to me.
You eat late and you lie down without moving around. So the next morning or thereabouts from there, you might begin to experience, constipation, the frequent passage of hours too.
So what are the symptoms of constipation? Aside being unable to pass out stool freely and frequently, what are the other symptoms of constipation?
Yes, persons feel this sensation of incomplete emptying of the bowel. What it means is that you see there's an urge to defecate, but nothing is coming out. The intrinsic muscle is relaxed, but the extrinsic might not be relaxed.
What are the intrinsic and extrinsic?
Yes, what I'm saying is that for you to be able to defecate, evaginate and evacuate the fecal content from your digestive tract, there are nerves that are responsible for it, the way I've said it earlier. So you can answer that. If you have constipation, there is this, disturbance that you have. You are not usually relaxed. So constipation would have not been a problem if you feel comfortable and...
we have a caller on the line. Hello.
Good afternoon.
Hello, good afternoon. What's your name and where are you calling from?
Good afternoon.
Good afternoon. I can hear you. What's your name? Hello? We lost that call. You can call the number. It's on the screen. Hello? Hello? We lost that call. Keep trying. Don't quit. All right, doctor.
Yes. What I was trying to say is that other than the fact that there's an abdominal pain as a symptom of constipation, there is also this sensation of incomplete emptying. So you feel the urge to defecate, but nothing is coming out. It's like you are feeling, you are feeling pressed down, but nothing is actually coming out. That will make you to be uncomfortable, as the case may be. Not only that, you might also experience...
Hello, good afternoon. This is Heady Living. What's your name?
My name is Joseph. I'm calling from Opa.
Can you turn down the volume on your television set so we can hear you clearly?
I'll turn it down.
Okay, can you do that quickly?
Yeah.
All right.
So you're talking about constipation.
Yes.
Yes. Your body, I can say an individual has different systems.
Different system.
Yes.
Okay.
Me, I can eat late hour and I
Okay.
will not get any constipation. In fact, I will even be the first person to be hungry the next day. So that's why I said it depends on the body system of individual. There are some that cannot take it. Like I wake up 12 and eat.
Okay. Hello?
Hello, I'm hearing you.
Go ahead.
So, depending on the body system, that's what you react to.
Okay.
Like, there are some things, when they used to say, this medicine that used to scratch the body, chloroquine, when you eat it, it scratches some people in the body. But there are some that will just eat it, that it will be normal. So,
Okay.
body system react to all these things that we are talking about.
So that's a submission that it depends on a person's
Yes,
body.
Yes.
All right, doctor, what's your reaction to that?
Yes, you are very correct because when I was talking about the gastrointestinal cause of constipation, I did mention some disease condition.
Okay.
Somebody that has diverticulitis, even somebody that has what we call intestinal irritable bowel syndrome. Sorry, irritable bowel syndrome. What it means is that such persons have, there's an irritation, a form of just to use a layman
Okay.
language. Okay, such persons will naturally experience constipation
Okay.
and diarrhea
Okay.
because of the way the intestine are. It's a problem, it's not a normal thing.
Okay.
Intestinal bowel syndrome. Persons of that group, they will experience constipation.
Okay.
And sometimes they will also experience diarrhea.
Okay.
Somebody that has like diverticulitis, the way I told you earlier on, such persons, of course, you expect them to have constipation. And you see, there are other conditions, maybe anatomical structure. Even babies too. Newborn babies, it's possible for a newborn baby, a day old, 2 days as the case may
Be
be,
constipated.
to get constipated. They will be crying. They will not be able to pass out stool. We call it Hirschsprung's disease. So it therefore means that those nerves I was explaining about, they are just absent in that
Baby.
alimentary canal. That
Okay.
baby was just given birth to at such.
Okay.
And by so, the best way of treating that baby is surgical operation.
Okay.
So I agree that it depends on individual. There's
Okay.
a way your alimentary canal is just designed.
Okay.
You will always experience constipation.
Constipation. Hello? Hello? Hello, are you there? Please turn down the volume on your television set. Hello? Hello? Your television is too loud. Hello? Okay, we can take the call. Please, when you're calling, turn down the volume of your television set. I know you want to hear yourself, but just listen from your phone and watch. Okay? So, doctor, this issue of constipation, is it any different from the experience? Is it any different from a man, a woman, or a child? Or is the same thing, whether you're an adult, you're a man, a woman?
Yes, it's the same thing. For as much as you fall into any of this category I've mentioned earlier on, and it's not causing constipation.
Okay.
So the symptom you feel is similar,
Okay.
irrespective of whether you are an adult or a child,
Okay.
or whether you are old or young. But pregnancy, as I've told you,
Okay.
in a lifetime, a woman must get pregnant, and they will certainly experience
Constipation.
constipation. And let me quickly say that the indiscriminate use of laxative.
Hello? Let's take this call. Hello? Hello? We seem to be having some form of connection issue. I think it has to do with the weather, but wherever you are, just keep trying keep trying. You never can tell, your call may just get connected. So doctor, we're talking about
Yes.
the experience of constipation
yes.
in man, woman, or children.
Like the women I was talking about, that for as much as every a woman must get pregnant in her lifetime,
Yes.
so they will experience constipation.
Constipation.
Yes. Your diet too. If you are the type that take little or no
Water.
or you take little or no fiber, some persons don't take vegetable.
Okay.
Some persons don't take fruits. They consume more of dairy, that is milk products.
Okay.
So milk is one of the cause of
okay. Constipation.
constipation. When you take more of milk, milk products, milk come in different sorts,
In different forms.
whether in form of ice cream, form
yes.
of just name it.
Anything. The one you take with your tea.
Yeah, exactly. For as much as you consume of milk, you are
Okay.
about to get constipated. Forget about the water in it.
Okay.
For as much as the milk is there, you will have constipation. So lifestyle is an important
An important thing.
thing to consider for constipation. And like as I was saying, the elderly, because of their immobility, is a common thing for them to have constipation.
Okay.
Because of the fact that they are restricted to one place and they are not walking around.
Okay.
Other than, disease condition that is either gastrointestinal and not gastrointestinal. So constipation is a thing that, though it's not life-threatening,
Okay.
it's not life-threatening, but then if it happens,
Okay, let's get to the treatment now. When it happens, what should you do?
yes, firstly, you have to change your lifestyle, adopt, a new lifestyle.
Okay.
Take, a glass of water,
Okay.
with or without food,
Okay.
every day.
Every day.
Yes, when you do that, when your water intake is more, of course, you are trying to avoid constipation.
Okay.
But I'm not saying that when you are not constipated and you take water, it will relieve it. No.
Okay.
The water is a kind of you are trying to be proactive at this point in
Okay.
time. So water will prevent the constipation. And when you are constipated and you now try to increase your fiber intake, take vegetable,
Okay.
take fruit, watermelon, orange, mango,
Okay.
and the like. When you take those,
And you must have one of these fruits in season. at one
banana.
time.
When you take those fruits, you will hardly
Okay.
suffer constipation because of the increase in fiber. Because fiber tend to increase the motility.
Okay.
The
movement. In the large intestine.
In the large intestine,
Okay.
exactly. That is what the fiber does.
Okay.
It's fasting it.
Okay.
So, other than that, there are drugs that are available
Okay.
for treating constipation. They are
Okay.
just simple laxative.
Okay.
And
Is
they
this
are-
something that one can just go over the counter and say, hey, I'm constipated, Mr. Chemist Man, give me something? Or you need to see
Andrew
a
liver salt,
doctor?
MC salt is one of the commonest drugs that you can buy over the counter, and is an example of is an example of a laxative.
Should one prescribe for
Yes,
himself? Or
that
need
is the
doctor?
problem. I was trying to say earlier on that the indiscriminate use of laxative, you just buy drugs on your own.
Okay.
These are synthetic products anyway.
Okay.
I've just said something about the natural, taking fruit,
Hello.
taking vegetable,
Hold on,
water.
doctor. Let's take this call. Hello. Hello. Hello, are you there? Hello. Oh, seriously, there seems to be a baby by the phone there. Hello. Okay.
Yes, the indiscriminate use of laxative, buying those drugs on your own, whichever
Okay.
way, to relieve your constipation. With time, it will even worsen the constipation.
Okay.
Instead, it has to be judicious use. A doctor will have to prescribe it for you. Because it is not just all drugs.
Okay.
Just like the way I told you, somebody that has a diabetes or somebody that has multiple sclerosis,
Okay.
or somebody that is taking a particular drug, for example, a calcium antagonist,
Okay.
like amlodipine, ifedipine, you know, just to mention some drugs that you take.
Okay.
Then you are not getting constipated. You don't even, you are taking those drugs.
Don't even know what the cost
yes,
is.
you are taking those drugs for more or less like for treating a chronic illness. That means you are
Okay.
going to live on this tablet for
A long time.
a long time, and you're not getting constipated. That at the same time, you're not going to buy a laxative.
And you don't know the interaction between
Yes,
these
you're not going
drugs.
to buy a laxative. It's like 2 steps forward, 2 steps backward, because you don't
Okay.
even know the cause of
The
the constipation.
But you know, some persons may trivialize that, oh, it's constipation, I'm just constipated. And you know, there are myths about this constipation. Some persons tell you that it's just when you eat at certain times. So if you're constipated, perhaps you ate late, or maybe you ate something that is not good for your system. And why some may also have a certain belief that, oh, this thing used to work. When you do this, when you do that, I've heard of some persons telling you that when you touch your tongue with your navel with saliva, when you're pressed,
Yes.
it goes away.
That is
So they
that.
come up with some funny things that when you do, and then you just get relief. So they may play down on the aspect of visiting a doctor, like, oh, for constipation, do
Yes.
I need to visit a doctor? for
Yes,
that?
all these are cultural ban syndrome. Just believing that putting a saliva in your
Yeah, in your
mucus-
navel.
Yes,
You touch your
it's
saliva
not-
with
exactly.
your navel with saliva.
It does not actually work in any way. There is no explanation to such.
Yes.
The only thing is that when you have constipation, it's not just to have constipation once.
Okay.
When it becomes a recurring thing,
Okay.
there's a need for you to see a doctor to evaluate and knowing the cause of this constipation.
Okay.
Because I did say earlier on that some life-threatening condition
Okay.
could
Presents.
present a form of constipation, like the colonic cancer,
Okay.
cancer of the colon, you know, the large intestine, as the case may be. Apart from the fact that you will strain to pass stool,
Okay.
you experience infrequent stool, even if it
Okay.
comes out very small, like that of the goat stool, small, in form of a boris. Apart from that, you also see blood
Okay.
stain or blood, fresh blood coming out from the inner region,
Okay.
as the case may be, and the person might experience weight loss and loss of appetite. So you might just, ignore.
Take it to be normal.
To be normal, exactly. And we did say that early detection is the gold standard way of treating cancer.
Okay.
So constipation is not just a thing you just say, oh, it's not constipation.
Okay.
Let me go and take something to just relieve it, as the case may be. No, you have to know the cause of the constipation, especially if it's a recurring
Okay.
thing. So other than medically, we are talking about the treatment, other than the drugs, sometimes there are conditions with which the constipation will cause a discomfort to the patient. And if you have seen somebody that
I have.
they move around like a pregnant woman,
I
somebody that
have.
wants to deliver.
I happened to be in a hospital one day, and then a man, a middle-aged man, came in with a wife. He was constipated. I think he said for days.
Yes.
He was restless.
He was exactly.
In fact, he didn't
moves
know
around.
shame at that particular
He
time.
moves
So I know
around.
how
He
discomforting
goes to the
it can
toilet.
be.
He comes out from the toilet.
Yes.
He's very, very uncomfortable. So it's not just it's only when you will just experience those mild ones. When
Okay.
you experience severe constipation, you have seen somebody that experiences severe constipation, you will know that, oh, this is a serious thing. It's
Okay.
a serious thing. So there are also procedures. We can
Okay.
do a kind of a soap water enema. We
Okay.
try to pass something that will increase the motility. The motility has to do with speed.
Okay.
When you put soap in your hand,
Okay.
it tends to reduce the friction.
Okay.
You can see that it's, when you rub your palm with the
Okay.
soap, it's free flow,
Okay.
like that. So that kind of, let's look at it from that form. So we put a form of a soap water and try to pump
Okay.
it through the
And this
anus.
can be administered at the
In
hospital.
the hospital, exactly.
Okay.
Maybe if the house treatment now phase, maybe you take vegetable, you are trying to take a lot of water, but the something still persists. And
Okay.
of course you're uncomfortable, you come to the hospital.
Okay.
So there, we know how to relieve the constipation. There are some constipation that might even result to surgical operation
Oh.
to relieve it, most especially if it's as a result of adhesion.
What's that? Okay.
That has to do with the intestinal twisting, kind of, you know.
Okay.
Like I said something about Hirschsprung's disease, the one that is very common among newborn babies.
Okay.
When the opening is there, but they are unable to pass us to.
Okay.
Or even if they do, very small, and they strain, they cry. So by so, it has to be through surgical operation to relieve and to correct the, you know, the nerves that are absent in there. Other than that, some persons might have complications as a result of chronic constipation.
Okay.
There
What
are
are the
complications.
complications?
Yes. Because of the straining, you know, the straining and the urge to pass us to, like the one I said earlier, because you feel that sensation of incomplete evacuation of the bowel, exactly. So in that case, there might be a kind of an injury to the rectal veins of the rectum. So there will not be a protrusion from the anus in form of a pie.
Okay.
Some persons that, you know, suffer pie as a result of the constipation.
Okay.
Pie could cause constipation. Constipation could also cause pie.
Okay, so they are linked.
Yeah, they are linked. Very well, they are linked.
Okay.
So it's a complication of, you know, chronic constipation. Not only that, there is an inner fissure because when the stool now is trying to, you are pushing, you know, the pelvic floor now is heavy. What I mean, the lower abdomen is heavy.
Okay.
It's trying to push down. You can see that the stool try to penetrate outside the opening, natural opening, which is the anus.
So trying to relieve yourself of constipation on your own when it becomes chronic is dangerous.
Yes, you might have inner fissure, you might have fecal impassion.
Okay.
The fecal impassion means that you know, colon now will just get blocked.
Okay.
So to the extent that no one will come in anymore.
Okay. So as we wrap up now, what's home practice or home remedy practice should one not indulge in when you have constipation, especially mothers who have little babies and they've observed for 2-3 days baby has not passed through, so they want to help instead of going to the doctor. What shouldn't they do at all, even as adults, that could make them come up with complications?
Yes, generally you have to obey the natural law.
Okay.
That is the defecation reflex. So the idea of you trying to suppress
it shouldn't be there.
Yes, when you suppress your defecation reflex, with time you are going to get constipated.
Okay.
Not only that, ensure that any food you eat is rich in fiber diet.
Okay.
Try and take a lot of water when you do that. Even exercise. Okay. Exercise very well. When you exercise and, you know.
You'll be good.
Exactly.
Okay. All right, that's our show today. I wish we had more time, but you know, hey, time is not a friend to anyone. And this is how we wrap up Healthy Living for today. Thank you, Dr. Jolly Nusaiguma, for coming today. You really educated us on constipation. So, you've heard it. Don't try to help yourself too much when you feel constipated. Visit your doctor. Don't realize like it's just constipation. And like Doctor said, do not suppress the natural urge to visit the loo. If it's possible for you where you are to use it, don't keep yourself in that kind of position. My name is Blessing AJ. I will see you again next week. Until then, be healthy. You know your health is wealth. Have a great day.